My name is Sarah Evans-Lotsko, and I'm Associate Professor, Research Fellow at the Care Policy and Evaluation Centre at the London School of Economics and Political Science. And I'm doing research about youth mental health and the long-term consequences. Because we know that the primary cause of disability among young people worldwide is not violence, is not obesity, it's not cancer. The primary cause of disability is neuropsychiatric disorders. And we also know that 70% of adult mental health problems originate during childhood or adolescence. And these problems can have real long-term social and economic consequences. So our research addresses a really important challenge to understand what are both the short-term immediate consequences of these problems, but also the long-term impacts for young people, families, and society.
Hi, my name is Derek King. I'm an Assistant Professorial Research Fellow in the Care Policy and Evaluation Centre at the London School of Economics and Political Science. This was the first study to estimate the cumulative monetary value of adolescent mental health problems in relation to employment and health service use outcomes in mid-adulthood. We looked at 3 nationally representative cohorts in the UK and looked at 3 types of mental health problems: emotional problems, conduct problems characterized by antisocial types of behavior, and hyperactivity. In relation to earnings, we found that the earnings penalty was largest for individuals who presented with conduct problems at age 16. By age 42, the average earnings penalty associated with having conduct problems at age 16 ranged from £175,000 for females born in 1958 to £460,000 for males born in 1958. Overall, it seems that those with more severe conduct problems had greater odds of experiencing unemployment and lower occupational status. We also found that conduct and emotional problems, particularly when coexisting, were associated with high costs to the NHS in adulthood in the form of GP visit costs. We estimated that collectively, adolescents with severe conduct and emotional problems will, as adults, make an additional 6,000 GP visits per year at a cost to the NHS of around £200,000 each year.
The good news is that effective care and support can alter the trajectories for these young people and reduce the cycle of disadvantage. So we know that between 1/4 and 1/2 of adult psychiatric problems can be mitigated or reduced through effective early intervention among young people. And there are some really relatively simple things that we can do to increase this access to effective intervention. So we've co-developed an app together with young people. And in this app, we identify and curate all of the different types of mental health services and support through NHS, voluntary sector, online and digital care, and we signpost young people to these different services and also share young people's stories about accessing this care and support. And we tested the app among 120 young people and found that young people using the app had reduced mental health problems and also increased access to care and support, even in crisis situations. And the thing was that about half of these young people, they really wanted to access care and support, but they didn't know where to go. And then also, young people really feared the stigma and shame that was associated with accessing care and support. So COVID has made this research even more critical. Youth are at particular risk of experiencing adverse health, well-being, and employment outcomes, and these have long-term consequences. But there are really easy things that we can do to improve and mitigate these long-term consequences. So for example, sharing information to improve access to care, even signposting young people to mental health services, and trying to do this in a non-stigmatizing way. Also use of digital technologies, which are easier to use, and there are lots of sources of digital technologies already available. There are different online peer support communities, for example, ZenZone and other online communities that we've been working with, which improve young people's mental health. We also can do really outreach, especially to really vulnerable populations. And so we need to think about how we can reach out and maybe combine different types of advice and interventions and other social protection programs together with mental health to really focus on those young people who are most in need.